Hello, my name is Dr. Iswara. I'm the Program Director in the Division of Gastroenterologists at Maimonides Medical Center. My specialty is training in the advanced therapeutic procedures, which includes biliary endoscopy, which is endoscopy of the bile duct, gallbladder, non-surgical removal of stones from the bile duct, and also I specialize in treatment of various colonic diseases where the so-called polyps, which comes in different sizes, big and small. The big polyps are traditionally removed by surgeons in the past. Now we are able to remove them with the special technological advances we have in our armamentarium now. So this is my specialty, advanced therapeutic procedures. Traditionally, the procedures what we do in gastroenterology fall into three categories: level 1, level 2, and level 3. The level 1 procedures are generally performed by routine gastroenterology in the offices. This include colonoscopies and upper endoscopy, which anyone can be doing it. The level 2 procedures are the one where you require patient to be done in an ambulatory surgery center. So our Maimonides Medical Center has a state-of-the-art, cutting-edge ambulatory surgical center. We are able to offer these procedures which cannot be done in the offices. This include the procedure called ERCP, that is endoscopic retrograde cholangiopancreatography, where we able to visualize the bile duct, look for stones, remove them, and also if there are tumors which are not resectable, we are able to place internal drainage using special stents. And also we also have at Maimonides Medical Center a special instrument called SpyScope. We are able to visualize inside of the bile duct through this special scope. By doing this, we are able to do biopsies, we are able to do stent placement, and also make diagnosis and treatment. So this is the only hospital which is available in Brooklyn, this special procedure. I'm fortunate that I was a pioneer to do that in the hospital. Because of that, we get referral from all 5 boroughs to do these procedures. So I'm proud to be one of those pioneers who can offer these procedures to the community. I believe in applying all the knowledge I have in the advanced therapeutic to apply to the patients who need them. So this will save them unnecessary surgery and also pain and suffering they have sometimes they go through the prolonged surgery. So this is one of my philosophies, to take care of these patients who are not able to taken care of by other general gastroenterologists. I think basically after seeing so many patients in New York and Brooklyn area, somehow I feel for the patients. Most of the patients whom I see, I put myself in their shoes when they are sitting in front of me. See what would I feel. So that's why always I don't worry about any insurance payments or anything. Whenever they come, they treat them, then you worry about the insurance later, There are many new current trends in these cutting edge technologies we have, mostly in the field of endoscopy. We can actually start from the top where we take care of people who have chronic gastroesophageal reflux and the heartburn and heartburn related complication. As you all know, if you're a patient who have chronic heartburn, sometimes predisposes to cancer of the esophagus. So we have technologies for which we can make early diagnosis, and also if you find any precancerous, we can treat them with there's a special radio frequency ablation of these lesions. It's called Barrett's technology. We have it here. And also people who have advanced cancers who are not operable on the esophageal cancers, we can place stents so they can eat and have a better quality of life. That's in the esophageal field. And also people who have swallowing difficulties, swallowing disorders, we can make diagnosis using special pH monitoring and find out why they have. Also, we have the pressure measurements of the esophagus. These are all not available on a routine outside practice, but we have it here, so we can make appropriate and correct diagnosis and give the appropriate treatment. Then I spoke about the biliary endoscopy. That's a cutting-edge technology. People who come to Maimonides, they get the state-of-the-art technological advances and the treatment related to all the biliary diseases. In fact, even just before I came, I got a call from another gastroenterology from another hospital. They want to transfer the patient from there for this special procedure. So we actually act like a tertiary referring center, something like a Mayo Clinic. We send patients. So Maimonides, we do that kind of the same procedure which is done in any advanced institution in the country. I like to tell the patients that first thing, I am a good listener. Anytime you see a patient and take care of the problem, the first thing we do, or my training also, I tell my resident, they had to be a good listener for them to be a good doctor, you know. So I believe in good listening. Talk to the patient, listen to their concern, then decide on the treatment. So that first thing is first listening. Second thing is we also give a good compassionate care. This is very important. Patients come to you because they have problems, you know. So your job is to give them compassionate and also a decent care. So these are the two things I believe in: listening and giving compassionate care. The third thing I also tell them, be available for them, you know, anytime, 24/7. So if somebody calls in the middle of the night, you should be able to give them the answer for their problem. Even could be a simple problem. Don't ignore their calls. Make sure that you talk to them well and give them the compassionate care. This will bring you, the ultimate thing is the patient satisfaction. If the patient is satisfied with you, they'll come back to you. They come back to Maimonides Medical Center. So these are 4 things I emphasize during my training: professionalism, compassionate care, and the communication skills. I've been at Maimonides Medical Center for the last 25 plus years. Most of the time I spent time training the other fellows. It was so gratifying to sometimes find out I have fellows who are trained, who are now practicing in every part of the country, you know. They call you, they talk about their practice, and they brag about their achievements in their practice. That makes me very happy. So this is one of those things in my career. I find it very gratifying. The second thing gratifying is I've been Maimonides for 25 years. Part of my career, I don't know if I told you, I spent in the military. I was one of those doctors who took care of soldiers who were in Middle East during the world desert storm. So this also made a lot of gratification because they're able to give back not only my patient, I also served my country and took care of the soldiers during the war. As you know, I'm from Sri Lanka. Tsunami hit Sri Lanka very badly. About 70,000 people died in Sri Lanka. So when I heard about it, a week later, tsunami happened. I went there as a volunteer with the foreign teams which were going to Sri Lanka. I served in the real tsunami affected areas. I went to different refugee camps and gave medical care. Since I knew the local language, I was a person who led several of these medical teams which were not organized. I spent almost seeing a couple of thousand patients who were affected by the tsunami. It gave me a lot of gratification that I was able to give back something, made a difference in some people's lives and the kids.